I'm Savannah Al-Badri and I represent Savannah Style Blog. Women have different opinion towards the wrinkles. Some of them they accept it, live with it, while others resort to some kind of treatment. Today I chose one of the most popular, some may say controversial, which is the Botox treatment. Unfortunately, women misuse botulinum injections, and instead of having a dose of fresh look and less wrinkles, they end up with a frozen face and archy eyebrows, and the worst, fake smile. 5 questions about the Botox and how to do it right. I'm gonna ask one of the leading doctors in this field, Roberto Viel from London Center for Aesthetic Surgery. So stay with me to know more about it and how to get the natural look. And if you have any questions, please don't hesitate to drop it to Savannah Style Blog. So tell us, Dr. Roberto, what is the Botox?
Botox is a neurotoxin derived from botulinum toxin that will stop the movement of the muscle because the nerve does not give the signal to the muscle to move.
And why do people use Botox?
People use Botox because it's a lovely drug that will release the muscle so there will be no lines, no wrinkles on your facial expression.
And how often should I do the Botox?
Botox is not permanent, so the beauty of this product, of this treatment, that you do 2 or 3 times a year to maintain a wrinkle-free look.
Thank you. And how often should people do the Botox?
People do Botox every 3 or 4 months, so basically the average patient can do Botox 2 or 3 times a year.
Okay, and how quickly does the Botox affect and how long does it last?
You will see the result of the Botox treatment after 3 or 4 days and the full result in about 10 days, and it will last an average of about 4 or 5 months.
Okay. And doctor, can the Botox be used to treat anything else?
Botox can be used for other indication, and one of the main indication apart of treating wrinkles is to treat the excess sweating. When you sweat too much, mainly on the armpit, is an excellent treatment to reduce the wet armpit.
Okay, is that all? What about the hand wrinkles?
Then you can use Botox also for the wrinkles on the décolleté, all of that. Yeah. Also, the other important indication is to treat migraine. Okay. When you have migraine, headache, you put in the right position in your scalp, in your forehead, and you will have a beautiful relief from your migraine.
Wow, brilliant. And how long does it last for the migraine?
Again, a few months, like 4 or 5 months. Yeah, depends on the dose.
There is a very important question that a lot of women, we see them having the archy eyebrow, the frozen face, or they call it the surprise look. Yeah. Sometimes there is a droopy eyelid. Why is that? Why is it happen? There is something wrong?
Yes, if you have all these kind of problems because there is something wrong in the technique or in the dose of the Botox, because it's important to inject Botox in the right muscle to achieve the result that you want. If you have a surprise look or everything is too frozen, something is done in the wrong way, or too much product or put in the wrong position.
Okay. What about men? Well, can they have the Botox, and is it safe as well?
Oh yes, men have Botox, and it's very popular among men, but we call it male Botox because the dose, the way you inject for a man is different, because a man has a stronger, bigger muscle with more strength, so I need to inject more and to be more powerful in terms of strength for the muscle.
So you mean there is a more dose?
Yes, it's a higher dose, and also you inject in a different way. Stop, because the result for a male is different from a female, so you need to adjust the way you inject, the position where you put your dose.
So is it possible to undergo the treatment and have a smooth appearance without natural look and avoid that face with the stiff or frozen look?
Yes, it's possible to have a more natural, smooth result, and what we call it baby Botox. Baby Botox is when you inject less, so you will have a more natural, smooth result, but the result doesn't last as long as we do the normal one. That also gives you the idea that there is also the male Botox. Male Botox is when we need to treat men. Men have a stronger muscle, so that means we need to inject more. So there are the two opposites, the male Botox and the baby Botox.
There is a misconception about the Botox that when it frees some muscle, then other muscles will be overactive. Is that right or wrong?
Most of the time is wrong, because when you freeze the forehead, there are no other muscle compensating. But in certain area of the face, for example, in the periorbital here, if you stop the muscle here, there are some muscle here that they may overreact and compensate the lack of movement there. So it's important to review the patient after 2 weeks and eventually to inject a little bit more there.
Okay. So how do you see the difference in the trend when the first Botox was invented and now in the 2018?
Yes, Savannah, this is a good question, because I started to do Botox in the mid-90s. And Botox was used for aesthetic indication in the late 80s, early 90s. So when I started in early mid-90s, everybody wants to be completely frozen, no movement whatsoever. But now instead it's different. Everybody wants to have a natural look, keep a little bit of movement, and that's possible to do.
And this is what you advise, and
yes,
you are experts with it.
Yeah,
that
correct.
You
We need to have a more natural look without to be completely frozen. Maybe do it a little bit more often, but maintain a natural look.